Hello everyone.
Hello.
I know you might be knowing why I called you. I want to just have a chat with this young generation, what they are aware of this fertility things, or is it like they're just not bothered about fertility, and how as these young girls mothers, what you feel about it. So let's just have a discussion, and I hope we'll give some points, some education points to this Zen Z and Zen Alpha, I think something to take home.
Sure, ma'am. Thank you.
Okay, well, let's start this chit chat, fertility chit chat, I would say, by introducing our moms and these young, beautiful daughters. So, we'll start with Saujanya. She's a good friend of mine. Her daughter Kushi, Nirupama, Anika, Vani, and her daughter Pooja. Unfortunately, she could be not there in person, but she's so enthusiastic to share her ideas. So she is online. So you can. Hi, Pooja. Thank you for joining us online. Yes. So this is Fertility Awareness Week, and see, God has given this huge responsibility. God knows, he or she, God knows that I think only one species has got that capacity to carry, and it is us, the females. So, somewhere it is us, we have to carry this, propagate God's species, human beings, whether it's animals or humans. So, we are empowered in that way. But somewhere I think in this last few decades, we have been postponing our, fertility choices. So, I want to start with you, Kushi. So, what do you think? You planned your career, right?
Yeah, I have. I'm going to college soon in a few months,
Yes.
and I'm going to be studying pre-medicine, and then I want to go to medical school. So
Yes.
I plan to become a doctor.
That's very good. So, these are all Gen Z girls who are very clear about their career choices. So, you are aware what do you mean by fertility?
Um,
Just
from
tell
what
us what you know about fertility.
So from what I know, I mean, from what I learned at school and from what I've seen online, fertility is basically the ability of someone to be able to bear offspring or have
Yeah.
children.
Of a woman.
Yeah, of a woman.
Girl.
Yeah.
Yes. And sorry if I don't want to intervene in your personal space, but you made your career plan. When do you want to start your fertility career? You made a plan?
So I haven't, I'll be honest, I haven't made as specific of a plan about that as my career, but I have a rough timeline, but it's not set in stone.
Just give us a rough figure.
So I want to, I mean, especially because I want to be a doctor, I know that it'll be a little more difficult, but I want to start a little later, I guess. So I want to get married around like...
Just give us a figure, 25, 26, 30, when do you want?
28, 29.
Okay. Coming to Anika.
Yeah.
Anika, so I think you got into you're starting your graduation now. I heard from your mom. So, and you're from non-science background, right?
No, I took BPC.
Okay. So, you'll have a little bit about fertility.
Yeah, I mean, I know all the terms and everything.
Yeah.
IVF, AI and all that.
No, let's not go into too much about it. I hope these Gen Z girls don't need to come to me for IVF. Hope nature helps them. But in your school, were you educated about, I've been to schools, they talk about contraception, menstrual hygiene and all. Have you, any teacher spoke about ovaries, eggs, when do they come? When do you should plan your marriage, following pregnancy? Were they taught in your school?
I mean, about ovaries and all, yeah, but not about marriage. Not about planning your marriage or your fertility or like how old you should be and all that.
Okay. You are aware?
Kind
When do you think is too old for a girl?
40.
Like you might be idea, like I think you girls might be gossiping around, oh she got married so late. So when do you think, marriage is too late? For any girl, leave alone you, for any girl, oh God, she got married so late. When do you think it's late?
I mean, I think it's not about marriage being late, but I think childbirth shouldn't be more than like 40 years. It's
Okay. Yeah. And when do you think it's early?
my age now.
So you think you're not ready even to think about fertility?
No.
Okay. Let's all ask moms. And Pooja? Pooja is, I know you're into your job and busy. So I think you little bit, the chit chat group is ranging from as young as 18 to spanning to 25. So Pooja, you might be little bit more aware than our Gen Z girls, I think, you being a millennial girl.
Yes, ma'am. So I think I'm the odd one out here because I'm an engineer. Like that was my undergrad, and yeah, I mean, like I did gossip around, like you said, what would be the ideal marriage age, what is the ideal fertility or conception age, and all of that. I think more than being it about too early or too late, it is a very complex kind of a subject because there are a lot of factors that come into it. But if you ask me, I think 35 would be like too late. Maybe naturally it might not happen. So that's my understanding.
Yeah, in a way you're right, Pooja. So yeah, as a fertility specialist, I'll be throwing some light, but I want to know. So we'll start with moms now. So Saujanya, I mean, you might have made plan for your daughter. You might have made a plan.
Yeah, I have a
Like you
plan,
and Naveen. Naveen is Kushi's father. So you made a plan for her right career. Like she should study here, US, UK, India, whatever. So at some point, I know fathers don't think, but as a mother,
Yes.
you might have thought, okay, Kushi should get married now, have a child. So what's your idea?
So yeah, I have definitely thought about it. So like when I was young, my mom used to say have 2 kids by 30. So that was when we were young. That was the timeline. Before 30, you have 2 kids. But I don't think that's going to happen with their
No, but-
generation.
But what you have in your mind for
In
Kushi?
my mind, ideally, if it was in my hands, it would be, get married by 25, 27 and have kids by 32, 33. So ideally, if everything goes well, that's
Nirupama, you made some plan or
Yeah, definitely. I did think and I did discuss with her and my son.
oh, very
too,
good, very good.
That this is what I would like. I know that's not what they want, but I said by at least 27, 28, both of you should, my son and my daughter, both of you should get married. But they're like, who wants to get married? Not me, not me.
25.
And Vani garu, you might have.
Yeah,
I think,
actually,
yeah.
I also.
You are in the process, might be also.
Yeah, I decided like that, but my daughter is a career oriented actually. Maybe she is more interested to settle in her career first.
Mm.
So that's what I
Do you
gave that
think it
freedom
is-
to her.
Okay.
But now we are planning. Now
Okay.
this is us.
But do you think if I am allowed to ask, you had puja when you were?
Yeah, I am at around 21, ma'am. 21.
Okay.
Around I got.
Yeah.
Yeah.
So what would you advise Pooja? Sorry Pooja, don't take it personally, but yeah, she is allowed to give you some advice. I know you millennials and Gen Z.
No, that's not a problem.
Yeah.
So I thought I want to have my daughter to be settled first career part, ma'am, actually.
Okay.
So that's she achieved, I think, now.
Yeah.
So this is the right time for her now to decide her
Fertility
yeah.
career.
She has more knowledge, I think.
Yeah.
Enough knowledge. on this.
Yeah. I think the millennials have a little bit better knowledge.
Yeah.
Like Pooja has definitely said that 35.
Yeah, she can write a book also on this.
Yeah. Anika, I know your careers might take you long years.
Yeah.
All your careers, and Kushi, I think, chosen field is medicine. So medicine will take you well into your third decade. So are you aware that you can test your fertility at some point? Somewhere you might want to test, right? Are you aware there is some simple test that you can test? Pooja, are you aware?
I mean,
Yes, I am aware of.
Yeah,
But
Anika, you are aware?
I mean, I didn't know it would be like a simple procedure. I thought
Okay, tell me what do you know how, that you can test your fertility.
I'm not sure for women.
Okay. Okay. And Kushi, you are aware?
I was aware of some of the different types of infertility, but I didn't know that you could test for them, like and be so sure about it.
Okay. Pooja, yeah, I think you look that you know. Can you tell you are aware of
uh,
that simple one blood test is there? I'm giving the clue.
yes.
Yeah.
Yeah. It is a simple blood test. So basically, the blood test will test certain hormones, some ovarian-related hormones like FSH and LH, if I remember correctly. And also, they check for PCOS just to check the quality of the egg and your menstrual cycle. So this can give a basic understanding into the fertility health of the woman.
Yeah, you're right partly, Pooja. But yeah, I know as a this test as a fertility specialist we tell. But there is one simple test called anti-Mullerian hormone. Moms, Saujanya, Nilpama, Vani, are you aware? Have you heard this test?
No.
No, nothing. Now you are aware.
Yeah.
It's simple blood test, and it will give you it will give you a figure. And anything below 1 or anything below 2, that means your egg reserve, quality, quantity are dropping. So now I made you aware.
Right.
Do you want your daughters to get it done at some point?
Yes,
Yeah.
definitely.
Even
Yeah,
out of just curiosity?
Yes.
Yeah.
Yeah, maybe not
Not
right now,
not
but
right now.
maybe
When
Yeah,
they are
like-
thinking of
No, but there should be
or-
some age cutoff, like, I know now they are in their late teens, but somewhere you should get them test done. When Saujanya,
I
when you
think,
want Kushi to have it, you want to have to have
yeah,
it,
definitely.
but when?
So I think mid-20s would be a good time for that.
23, 24?
Yeah, yes.
Kushi, are you ready? Your mom is telling she wants to get it tested. You are curious to know?
I think definitely not now.
Yeah, definitely
but
not now.
I think maybe later it would definitely be helpful in
Okay.
getting
But-
that started.
With the Gen Z, the later I think is where I think Nirupama, are you? If Anika says I want to get it postponed later, would you agree or would you rather encourage her?
I think it depends on the situation that time. If she's ready to get married and or maybe couple of years here and there before that or after that, definitely I would like to get it tested to start any kind of treatment if necessary during that time, if it is necessary. So yes, not immediately, but maybe when they're of marriageable age and when they are thinking of getting married and planning to have kids.
If I say, Vanigar, if I say like Nirupama said, I will get it tested done, I think most of moms would say when they plan to get married, after trying, and if they don't conceive, then we'll get it tested. Do you think is it too late?
Yeah. I think it's too late only. It's early awareness is first.
Yeah.
It's
So would you
advisable.
tell your daughter Pooja, now she's coming
I want
into her
her to be
20s,
done it immediately.
to better to get it done?
Yes.
At least let her she be aware, because
Anything.
millennials are, let them be aware. And as a mother, I think we are all experienced. We know we have gone through. So you would be in a position at least to
definitely.
advise her something.
Yeah, Pooja, actually, I want you to. Yeah, this is most important point Madam told actually. So that is required, ma'am, actually.
Yes.
One question, ma'am. Anything actually? What are the symptoms we can find generally with the declining of?
Unfortunately, there are no symptoms.
Without test.
Unfortunately, when patients come to me, I see 25-year-old, because we get range of patients from not only urban people, they come at 30s.
Okay.
We get patients from rural in 25, 24, and they're struggling with infertility. And one of the very basic investigations we do is AMH, and they're low. Low is anything below 2. 2 is like borderline. Anything below 2, I'm surprised, and they ask me, I'm only 25, they're angry.
Yeah.
In fact, how come? They don't want to believe the test. They say, we'll repeat it in another lab. And the results are not going to be any different.
Yeah.
A little bit variation. So there are no symptoms of your ovarian egg quality or dropping. There are no symptoms of it. No Akashavani to tell you, okay, Kushi, now this is a high time for you to get married and have children. Same thing for you, Anika. Each woman, each girl has got their highest reproductive potential. In fact, if I say you won't agree anyway. Even your moms won't agree. The best age to get married is in your late teens. That's nature. Nature has kept it like that. You get lovely, genetically normal eggs in your late teens, even in early teens, puberty.
Early adulthood.
That's where our grandmothers got married, and we are all normal sitting here. The more you postpone your pregnancy, there will be a genetic alteration in your eggs. So now I have given you knowledge. Have you changed anything? Your fertility career plans?
Puja.
Sorry, I think you're a little bit in the millennial zone, so I think mom wants you to know.
Yes, ma'am. I've already got these tests done, and I keep checking my hormonal levels regularly.
Yes.
As such, since I eat little nutritious food, I think I'm a little, I'm okay with it. But yeah, this is a good insight to kind of start planning the fertility career, as you say.
Okay. And I just mentioned that each woman has got their highest reproductive potential. Commonly, I said late teens or early 20s is where you get pregnancy just like that and normal child you get. But we don't know. Even for a 21, 22-year-old, sometimes we get surprises because each woman has got their own reproductive potential. For Kushi, it might be 21, 22. 24 might be late for you. For Anika, maybe you're 23, 24. So 28, 29 is late for you. For you, Pooja, it might be similar, 24 to 26. 30 is too late. It's late where even fertility treatments can't help you much. Okay, I know, Kushi, you are in a field, you're going to medical field, hopefully. That field you want to excel, it will take into your third decade.
Yeah.
And I think your mom, what would you say if she wants to get married late?
So from the recent things that I have seen, like I follow your page, I keep listening to all your advice. So after listening to those, I feel like this generation, they have to be made aware of their, because I know their age, they still think they are, they don't think about infertility at all. They think, they are quite young.
You
and all
feel,
that.
Nirupama, you feel they should think?
Yes, I mean, according to what you just said.
See, this
now,
generation,
this
they're
has
planning their careers, even
yeah.
as parents.
Yeah.
But as moms, I think you might have had, okay, my daughter should get married,
But
like
even
you
though
said.
they have to create their safe space
But
to have
most
the
of them are
conversations,
unaware.
no?
Like
age.
Gen Zs, they are so much into social media,
Yeah.
still they're unaware.
Yeah,
Now I made them aware that there exists a simple blood test
Yes.
and it will give you a rough estimation. And so, Nirupama, let's say Anika has come with some decision after a few years, like she wants to postpone her marriage. Is there anything like you would advise, or girls, there is an option?
Yeah.
Yeah, Anika,
I've read about. Okay.
That, let's say you want to get married late. And then in our country or our culture, I think we start our pregnancy planning only after marriage, unlike the Western culture. So let's say you see your career took you to high pathways which led to delaying your marriage, obviously your pregnancy. Do you think is there any way, some shortcut is there, or something the science can help you in some way?
Yeah, I mean, IVF and all. I mean, if I'm infertile, then
But before that, there is an option. Kushi, you're aware of it?
I think there's a way that you can freeze your eggs, and then later down the path, let's say you want to start having children, then you can freeze your eggs and then you can use them later on when you're ready. So I think, if I'm not wrong, I think that's one of the ways.
Okay. So moms, Saujanya, Nirupama and Vani garu. So if your kids say, I want to freeze your eggs, Are you okay for
I'm
it?
fine. I'll say go for it. Yeah.
Yes, but
I think even different moms have a different
Yeah.
opinions.
Yeah.
I would say go for it, but I would still encourage her to, marry early and get pregnant early, because it's not only about becoming pregnant and having a baby, it's about raising the kid. As they grow older, I feel it becomes tougher for them to, and as grandmoms that time for us to manage. So, I would always feel that they should do it naturally and go with the nature than
And
Yeah.
you, Vani?
Yeah, same ma'am. Actually, that is the more important to
Now,
get
would you advise Pooja? Unfortunately, I think Pooja got cut. So, would you advise Pooja to freeze her eggs?
Yes. Yeah, that is a must for her now. With her age now.
It's not must, but do you think there is science is there to help
Yes,
you?
yeah. That
So,
it should be a second choice option is what
yeah.
I feel, that because it is there, it's not like you should postpone everything and wait for it.
But how far it is safe, ma'am? Is it a temporary kind of?
See, whatever,
Sense,
I am ideal
control.
person.
Yeah.
Nothing can beat nature.
Yes.
I would still say, my daughter, I would say Harshita, I would say get married by, like Saujanya said, get married by 25, 26, have your kids before 30, at least one.
Yes.
Yeah. But millennials and Gen Z, are you going to listen to us? I don't think so. We don't know how your career is going to take you to which high paths. All these are ambitious type A personality girls now. So we don't know, we don't have a say. So yes, egg freezing is an option, better than you having pregnancy after 30s. And when do you want to freeze your eggs? Let's say there is an option. Now you're, I think, Pooja, Kushi, moms, Sanika, everybody knows. Yes, there exists one blood test and there is science can help you in form of, I think we are all aware of egg freezing, right, Pooja?
Yes.
Yes. So when do you want to freeze your eggs? I'll ask each one of you, give me one age range where you want to freeze, starting with you, Pooja.
Maybe around 29, 30, like that.
Okay. Pooja says 29, around 30. You, Kushi?
I would say from what we talked about, I would say a little earlier, maybe 25 to 28.
25 to 28.
Yeah.
And you, Anika?
I would say like 22 to 25. Earlier.
And moms?
Yeah, 25 is the right time. 25 to
No, I would
26.
say, as we discussed earlier, that the best eggs are immediately after puberty and in the teens.
So don't say now to freeze our eggs.
I was just going to say that. Let's go now.
This is depending on the age and fertility curve, ma'am. Actually,
So probably 1920 for her.
No, I will do after 21.
Yeah, I mean, if they know that they are not getting married or not ready to have children by 27, then I would say around 25.
Okay, yes. Like Nirupama was in fact partially right. Yes, the best age is when you're young. But I think we need to get a balance. We can't ask teenage girls to freeze their eggs. And we can't ask 30 is a little bit old Pooja to freeze eggs. 30 is when you should get pregnant, not freeze eggs. Well, if these millennials and Gen Zs accept these moms' advice. So as young as you can. There is no cutoff. All are you right? Yeah, 29, 30 is a little bit late, but better late than never. So you want to take your career beyond 30? Yes, freeze your eggs at 28 to 30. But I say as you are a very smart generation, your millennials or Gen Z are more smarter than us. You have made your choices. So your choice, I would say as young as you can, maybe in your early 20s to mid 20s. Early 20s to mid 20s. Because I think by 20s you know where your career is taking you. Now you are not aware like when you should get married. But I think by 23, 24 you are clear in your mind.
Yeah.
So either you get married and have children. That's the best thing. Or freeze your eggs and then
So, is there a time limit for the frozen eggs to be good or no? Any number of years?
and the
Yeah,
quality
that is also.
quality does deteriorate with a more number of years, but there is a legal framework in our country we can freeze eggs up till 10 years.
Okay.
Legal
So that
framework.
needs to be considered, right? If they freeze too early, then they should.
Yes, that also you need to
Yeah.
think. I mean, I haven't come across any teenage girl or 18 to 20-year-old except cancer patients.
Okay. Okay.
For them, they have no choice.
Yes.
For them, it's immediate. They come, they freeze.
Okay.
And they have to survive that disease, that horrible disease, and come back to us. But legally in India, yes, 10 years. Yes, with more freezing, the quality can deteriorate.
Okay.
So I'm happy if I get more number of eggs, quality-wise and quantity-wise.
Okay.
And that's where your age is in between early 20s to mid 20s.
Okay.
So
you can only freeze once, or can we just maybe?
yes, you can
do it
freeze. I
couple
mean,
of
if you really freeze in your early 20s, if your ovarian reserve is good, we'll get as many as 10, 12 eggs.
Okay.
Usually scientifically we need 10,
Yes.
12 eggs to make 1 or 2 good embryos. Yes.
How do you remove the eggs?
Very good question. Yeah, this is, and that's when I think these girls get scared of, even the moms get scared of.
Yeah.
They think we cut to your tummy open and then take the eggs out. No, it's a very simple thing. Just we'll give you some simple medication like insulin, small invisible needles. Just come in your periods, 9 to 10 days of injections, some 20-minute procedure that will be covered under sedation, get eggs out and freeze. And from very next day you can work.
Ma'am, is
So-
it possible in that eggs actually any genetic related issues will be
That
there?
also
That
we
also
can
can
test.
be found?
Yes, that also we can test.
Okay.
But usually, like I said, at 22 to 25, very rare to have genetic diseases. But you have genetic disease in the family and you
Family
want to
and all.
test that egg is carrying the gene. Yes, there are.
That also can be
There is a
possible.
provisions we can test those eggs.
In India, actually, I think it's not that much facility.
No, it's there. It is there.
Yes.
India, we have got. Yes. So hopefully, I think our informal chit chat with these young girls and
Really
their
very
moms, maybe we have helped or educated some of those young girls out there, these Zen Alphas and Gen Zs and millennials, at least to get that one blood test done.
Yeah.
And then, yes, and obviously contact your mom. Moms can contact us if you need any help. Okay? Thank you
Thank you.
all of you for
It's also
joining
more,
this
it's a
session.
lot mean
Thank
to us
you,
also
Durga.
to understand.
Thank you.
Thank you.
Thank you, Pooja. Thank you.
Thank you, ma'am. Thank you.
Yeah.